friends, so today I wanted to talk about what is a physical. Everyone needs an annual physical. That's where you see your primary care physician once a year to get routine health maintenance completed. Now, what we do in each of those visits varies with each decade of life. So that's what I want to go over today. What you can expect based on your age at that routine physical. So, during childhood, these visits are called well-child visits. Now, during this time, your pediatrician or your family medicine provider should be evaluating your child's developmental milestones, making sure that they're on track and meeting each of those. And also, this is the time to complete any recommended vaccinations based on their age. Now, in the first year of life, we tend to see a child every few months. And then once you get in the ages of 1, 2, and 3, we cut that down to approximately twice a year. After the age of 3, then we start seeing a child once a year. And again, we're screening them for any deficits in those regular milestones that they should be completing and experiencing. Also during that time, any concerns on their weight can be addressed. So if a child is overweight or if they're in a certain percentile, then they all should be monitoring their blood pressure and possibly even any labs to look at their cholesterol and check them for diabetes. Once you get to your 20s, that's when we should start checking urine for males and females. We want to screen that for blood, bacteria, especially sexually transmitted infections. And for women, we also start screening with cervical cancer screening. So during your 20s, that's when we start screening we add urine to your screening. So we screen your urine for blood, bacteria. We also screen it for sexually transmitted infections. And for women, we start cervical cancer screening. We'll get more in detail on that at a later time. In the 30s, then we can start adding labs. Now, we also can do labs earlier in your 20s, but really that's based on family history and your potential risk factors for any other chronic conditions such as diabetes or high cholesterol. But generally, we start screening for that in your 30s. Your 40s, for women, we add in mammograms. Yes, ladies, we need to get those breast screenings. And again, I can go into more detail of mammogram at a later time. Once we get to 50, that's when we add in the colon screening. I know it sounds scary to most, but we have many different ways now of screening for colon cancer. And I'll talk about that at a later date as well. But in your 50s, we add in colon screening. And finally, for men, once we get to the 60s, that's when we can start doing screening for prostate. Now again, all of these are just averages based on your family history, which we all should be discussing with our parents, our grandparents, aunts, uncles, any family that we can find to discuss family history, which are any illnesses that have been known to be prominent in the family, because any genetic risks will definitely increase your risk of getting those illnesses, and so we want to screen earlier for that. Everyone should get checked out. Physicals are covered by your insurance, so take that to your advantage and get your annual physical. Bye now. Stay healthy.